So we start discussing the surgical treatment of scoliosis when curves become 50 degrees or more. The reason that is because the bigger the curve is at the time that the patient reaches skeletal maturity, meaning they're done growing and their growth plates are closed, the more likely that curve is to continue to progress over time. And we found that the curves that are over 50 degrees are the ones that have the worst chance of progressing. And so the reason to do a spine surgery is to halt the progression of the curve so that it doesn't continue to get worse as the patient gets older. And we recommend this in adolescents because it's a lot easier for the patient to recover from that surgery. And having to have an adult spine deformity surgery is much more challenging with a much longer recovery. The results are a little bit less reliable, healing is less reliable, and we just find it's a lot easier for adolescents to go through. So the main goal of the surgery is to stop the curve from continuing to get worse. So by fusing the spine, meaning that we get all the individual bones to heal together into one solid piece of bone, we can prevent the curve from continuing to get worse over time. That's the main goal of surgery and the reason why we would recommend doing it. I would say that the secondary benefit of surgery is that we get a chance to correct the deformity. So we can make the spine straighter, and then some of the rotation problems that come with scoliosis where patients will have a large rib prominence or some chest wall deformity, we can make a lot of that better by being able to straighten out and derotate the spine during the fusion surgery. In general, the treatment of scoliosis depends on a couple things: the age of the patient and then the size of the curve and what type of curve they have. So, for younger patients with a curve that's between, 20 and 25 degrees, that's when we typically recommend bracing, assuming that they have at least a couple years of growth left or 2 years of growth left. For patients who have curves that are less than 20 degrees, those are the ones that we'll recommend observing with just getting serial x-rays over time to see what's going to happen with that curve. Sometimes those curves just stay put. Sometimes they tend to get a little worse as the patient grows, but we'll keep a close eye on those to make sure they don't progress into the bracing range. And then similarly, if they have a bigger curve, but they're really done growing or very close to being done growing, those are also curves that we would just watch over time with x-ray and not do a brace because there's just not enough growth left for the brace to be helpful with the curve. The patients who we start talking about surgery for are those who have curves that are over 50 degrees. And those are kids of kind of all ages. The younger the patient is, there are some other options for treatment of the curve. It's typically the adolescent children that we're talking about doing spine fusions on.